So the next thing that can happen is we've gone from having our toothache and now we start to get some swelling. So it could be swelling in the lower jaw, could be swelling in the upper jaw, could be underneath the lip, it could be anywhere in the face, mouth, teeth, underneath your tongue. And there's loads of different reasons for getting swelling. Let's deal with the toothache bit first of all. So the nerve of the tooth has died off, it's become infected, and now what we've got is an abscess forming. That the abscess, because of the nature of the problem, causes all the cells around and about to become leaky, and all of the fluid then from those cells leaks out. That's what causes all the swelling, and of course we get buildup of pus and accumulation of all other sorts of other nasty things. Once the swelling starts, you definitely need to make sure you've got some advice, and absolutely antibiotics are going to be the way forwards. Typically they will resolve the problem in the majority of people. However, if that swelling doesn't resolve, and I'm sure once you sought the advice, you got the antibiotics, the dentist is going to be calling you back in a day or 2 days just to check on the progression of everything. Get in touch with 111 if you start definitely to feel that your swallowing is being affected, more importantly your breathing is being affected, or if it's in the upper jaw, that we're starting to find that the eye is closing, or we're starting to get eye symptoms, so blurred vision, that sort of thing. If any of those are happening, then it's 111. Get in touch with them and seek further medical advice and assistance you'll need it if it's getting that bad. Sometimes what will happen is the swelling will come out and it'll pop, so it'll drain itself, and unfortunately what happens then is you get a nasty taste. Obviously at this point we're rinsing with some warm salt water, we're trying to encourage all the nasties out, we're getting rid of that, we're spitting it out. It doesn't matter too much if you swallow it. The stomach's very, very good at killing off things. All that acid in there helps dispose of the bacteria and all of the nasties that you might be swallowing, but if we can spit it out, clearly that's going to be the way forwards. Make sure that you're keeping on top of things, and again, if you keep, even if it's just a mental diary of where the symptoms were, when they started, how bad the swelling was, the sort of duration of things, then it's going to help whoever's going to be looking after you going forwards do just that, looking after you going forwards.